So why is it important for behavioral health counselors to screen for gaming disorder? Gaming disorder has only recently been started to gain official recognition uh, and consensus across various fields of medicine, particularly with the World Health Organization's official recognition of gaming disorder as a diagnosis, and the DSM-5, including it in their conditions for further study. Specifically internet gaming disorder. I'm hoping that with time that will expand to include a much broader definition. But even with that definition, going by their criteria, there's a huge amount of people out there who are suffering from those criteria, from those symptoms. There's a huge amount who meet those criteria. It's a greatly underdiagnosed and undertreated condition. Few clinicians have had training in how to approach it, it's important for behavioral health counselors to screen for it because it can cause so many problems in people's lives. It can be the reason people are dropping out of school, or the reason that they're failing to launch, or it can be the reason. It can be a contributing factor to anxiety and depression. And it's particularly important to screen for it because even if it's not the primary problem, or even if it's mixed in with a bunch of other psychiatric or psychological issues such as anxiety and depression, often you can't get at treating those other issues, and you can't have successful treatment until you've addressed the addiction, the screen addiction. So even in cases where there's a lot of underlying issues to the screen addiction, those issues may not be addressed until the screen addiction is dealt with. So here's a few of the key issues I look for when I'm assessing for gaming disorder. I look for how is the gaming and the time spent on games and the inability to get off games affecting their social lives, right? Like their social functioning, their ability to maintain relationships, to make friends, to reach out and to other people, to initiate conversations, or are they socially withdrawn? I look at how it's affecting them academically. What are their grades like? How has gaming changed their grades, if at all? What's their academic status or their career status? Have they lost jobs because of it? I also look at how it affects their family relationships. And I look at how it affects them psychologically. Are there things like anxiety and depression that they're using games to escape from, creating a vicious cycle? I look for health issues. Are there physical problems that are being contributed to by excessive gaming?